I'm Jenni Gabelsberg. I am the owner and founder of Women's Advantage Men's Optimal Health Physical Therapy here in Southern California, affectionately known as WAMOH, PTOT now. And I've been a pelvic health physical therapist for way too many years, 27. I've been a PT for 30, but moved into the pelvic health realm about 3 years into my practice. Oh, and then I started this company when, 24 years ago, and have been teaching for Herman Wallace Pelvic Rehab Institute for the last 20 years as well.
Now I understand there's a university associated with WAMOH.
Yes, so we tend to be very academic focused. It's one of the things we feel very strongly about. One of our core values is relentless curiosity. So we don't want providers that are not people that are always wanting to learn and do some self-initiated learning, but then also over the years we realized that so many clinicians, as you know, when you graduate from PT school or OT school, if you got any pelvic health at all, you were lucky to get maybe a lecture. Some universities have some electives. So we're starting with clinicians that are really hungry for mentorship and hungry for knowledge in general. So we worked for the last few years to really try to fine-tune what we think kind of the perfect mentorship program should be. So we designed WAMOH University. So it's an internal mentorship program where our new clinicians, sometimes new to pelvic health or brand new to their first job in their career, where they're getting weekly mentorship for the entire year. And we also send them to multiple Herman Wallace courses. We do quarterly journal clubs. We do extra Pilates trainings. Like there's a lot built into that training with the goal of being really solid and being able to treat pretty much any pelvic health diagnosis by the end of that first year. Like I look at these and think it took me 10 years to get to where our clinicians now are getting after 1 year, as long as they're getting that support and kind of structured learning. We also do have a 12-month pelvic health accredited residency. So I don't know how many there are in the US now, 15, 16, 17, something like that. I think there are only 2 out of outpatient centers across the US. We're on our 5th cohort, so we take 2 residents a year now.
I can speak to that with residency training,
yeah,
right? And so you have an internal university mentorship, and then also an accredited residency.
Yeah. Because we know not everybody can afford to do a residency, right? It's a very low pay. It is a pretty aggressive academic training. And so we wanted to find that line of giving them a little more support, not to the residency level, but they still need it. And that obviously has morphed a lot over the years. It used to be a much shorter program, but then people take the colorectal advanced courses, or they take the male body advanced courses, or they take the advanced vulvar pain. And now they're seeing a whole new set of diagnoses that they weren't seeing at the beginning. And so that really lends itself to the fact that we need to mentor them for that entire year as we're exposing them to all these new things, the more complex that diagnoses get.
From the patient end of things, we know that physical therapy, occupational therapy, they're not usually first-line treatments for patients who are dealing with pelvic pain, incontinence, postpartum recovery. What have you seen as the value that you've been seeing from patients who have gone through therapy here? What's been the biggest value to them?
Yeah. Well, you could read our Google reviews and get to read a lot of those, which is really such a joy. I've pulled out of treating the last few years. When I was a therapist, that was such a joy to me, being able to hear all the patients' stories. And now the stories I get are the people that see me in the hall and they're like, "Are you the owner?" Because they've seen me on some of the welcome emails, and I'll say yes, obviously. And they'll say, "Thank you so much for having a place like this. We didn't know places like this existed, and you have helped me so much." So that's lovely to get to kind of hear those, that kind of feedback from our patients. But one that comes to mind when you ask that is about a month ago, I took my youngest, who just turned 16, to a job fair at the local hospital. He's leaning towards medicine, my only one of my three leaning that way. And we're walking around the job fair, and this woman who works there at the hospital, because she's got the little shirt on, was like, I know you. And I'm looking at her, she's vaguely familiar, and she leans in and goes, you are my physical therapist. And my son's right there. And then she leans in closer and goes, you treated me for vaginismus, which is pain with penetration. So then I remembered her. She was one that had never been able to have intercourse and desperately wanted to have children. And then she turns and says, that's my 10-year-old and that's my 7-year-old. And it was like, I think both of us just started crying. And she said, I'm so glad, to have run into you. And it was just such a joy for me. Also kind of fun for my son to see that his mom has done stuff, to be able to be that kind of role model. But those are the kinds of things when we have patients come back and go, will you take a picture with us and our new baby? Because I couldn't, especially with the vaginismus patients, we couldn't have penetration, so we couldn't get pregnant. And that has been definitely a joy. But impacting kind of any of the, whether it's bowel health or keeping people out of prolapse surgeries, helping our male-bodied pelvic pain folks who don't get nearly enough care with their problems. They all get told they've got a problem with their prostate, and very often that's not the case. So it's really nice that we work with people from 3 to 96, 98 has been our oldest. So we really get to see a lot of people struggling with a lot of different pelvic health conditions.
Tell me a little bit about the Birth Empowerment Program.
Yeah, so when somebody has like ACL surgery in their knee, they go to physical therapy before, they go to physical therapy immediately after, and that's just standard of care, right? It's what everybody does. The ortho surgeons don't even think twice. They send pretty much everyone to PT. And yet we're asking people to grow and birth humans, and there's no standard of care in the US. So we know that that's lacking. A couple years ago, the APTA asked for people to apply to be writers of a bill called Optimizing Postpartum Outcomes that is now in front of Congress again, basically asking for 100% coverage for 1 prenatal and 3 postpartum visits to be paid as standard of care, like a mammogram, your well woman exam. And I was one of the 8 chosen to write the bill. So we spent 6 months on Zoom meeting with a lot of brilliant pelvic therapists across the US, and so came up with this bill. And at the time I thought, we need to make this a standard of care structured education. Like, we know what people need to hopefully prevent pelvic floor injury during birth. We know that if they get acute pelvic floor instruction, that we have less incontinence and prolapse long term. We also know that the #1 reason that female-bodied people end up in nursing homes is urinary incontinence. And their highest risk factor is having a vaginal birth. So why are we letting people just leak and think that that's okay? So we designed 3 prenatal, 3 postpartum visits that can be delivered completely remote. That we see them like in 3rd trimester for the 3 pregnancy, and it's a lot of birth prep, how to push well, what to do very acutely after. And then we see them at 2 weeks, 4 weeks, and 6 or 7 weeks postpartum as well. We then kind of took that and morphed it as well into a in-your-home program. So we have a acute postpartum visits at week 1, 2, 4, and 6, where we can go into the homes locally. I'm hoping to be able to grow that, but we need more and more therapists who are interested in that and trained. I was so appreciative of your training in the very acute care world because I've been doing pelvic forever, but I don't see people in the first month after that massive medical change in their status. And I wouldn't have felt comfortable going in and seeing somebody at 1 week because I didn't know what vitals to follow. So to be able to do your certification was extremely helpful as well. And if we were going to be doing that, I wanted to make sure that we had all of those kind of guardrails in place if I'm sending people into patients' homes to make sure all of them are safe.
What's been the biggest response from that program?
We are just starting to get it rolling. So we are starting to see more physicians buying into that and starting to refer them over. And then I thought, why are we waiting for the physicians to send it? So we get a ton of pregnant patients coming in for sciatica or pelvic pain. And so now we are educating them about the value of acute postpartum care and starting to encourage them all to do this remotely. And then at 7 weeks after they get their clearance from their OB, then they can come back in and have in-person care. But now we haven't missed that kind of crucial window where we know we need pelvic floor, deep core kicking in well. We know maternal mental health concerns happen before that 6 weeks, lactation challenges. So being able to intervene in a much earlier time period is really valuable.
What are the biggest opportunities you see now for rehab therapists in maternal health, pelvic health, just women's health in general?
Yeah, I think, well, one with social media, that it's much easier to spread the word. When I started, there wasn't any of those kind of opportunities since it was 2.5 decades ago. So I would say that's probably the easiest to be getting in front of people. I think the acute postpartum phase is really a time that is so underserved. I mean, pelvic health in general is still underserved, but that population specifically. And I remember taking a course with Herman 25 years ago, a pregnancy rehab course, and her saying kind of the postpartum population is the most underserved population out there. And we haven't made enough changes in the last 2 decades to be able to address that. But I do feel like we are getting there. I was speaking with one of the OB directors of one of the local hospitals in the last couple months, and we were talking about this need for more of their patients to get postpartum care. And she said, Jenny, we are so busy. We are seeing so many patients that either we don't remember to refer them, or we remember, but it's going to take too long to explain why, or we do actually have the time and we send them. And this is coming from one of our biggest referral groups, so they do get patients to us, but it was so interesting to have them acknowledge they're not sending enough. And actually one of the other docs from that group called me 2 weeks ago and said, I saw your flyer. And I'm like, okay, which flyer? About acute, actually prehab for cesareans. And the research showing that postpartum, less pain meds, less pain overall, faster return to function if they had pre-op for elective cesarean. So they knew they were going to do it, and they came in before. And she said, I've decided something. And I'm like, okay, what have you decided? I'm like, am I jumping in a landmine here? She said, when things come across my desk and they're kind of interesting and I don't fully understand it, I'm going to call. And I was like, this should be a thing, right? Like, why is this a new thing? But I appreciated her honesty. And she said, okay, so I understand that this is valuable to send people even if they're gonna have an elective cesarean. And we definitely have a lot more people now asking for birth prep specifically. So the patients are driving it. She said, I don't know what ICD-10 code to use. I'm like, I can help you with that, right? So I'm glad to see that there are some changes and people paying a little more attention. But I think also our medical colleagues are so bloody busy. We had somebody come over and shadow one of our therapists, Mahala, who you met, for about 6 hours. And this is a gynecologist. And she has been referring to us for over 20 years. She delivered my firstborn, who turned 21 last week. And after, she said, I don't think I knew 80% of what you did. Like, okay, so now you have the chance to refer more patients. And she'd been sending all this time, but she really thought like this narrow patient population was what we treated. She didn't understand the impact of prolapse and the impact of constipation and all the bowel disorders and things that we also can treat. So part of what we need to be doing as new providers, or just adding to pelvic health in the world, is educating our medical colleagues on the value of what we do.